Hey, good day and good evening, everyone. I hope you've had just an awesome Tuesday so far, and I'm glad to see you all here. First of all, please let me know if there's no issues with sound and just give me a sign if you can hear me loud and clear, and we will then start. Hopefully, everything is just okay, so I will appreciate your feedback if anybody can tell me by writing in the chat section. And yes, thank you for the feedback already. I'm Sophie and I'm your host today, and welcome to IVF Webinars by Egg Donation Friends. Why do we meet here every week? We are meeting here every week to guide you through your IVF journey. And how we do that? By linking you with best fertility experts from all over the world. And we want to support you with their knowledge and their experience, which they share with all of us. IVF webinars are a vast source of reliable content available for you 24/7 at our website, eggdonationfriends.com/IVF-webinars. IVF webinars are brought to you with help of our partners, and our partners are National Fertility Society, Fertility Clinics Abroad, and Donor Conception Network. And today, this evening, we are here with Dr. Maria Arque, International Medical Director at Ferti International. So our good evening goes to Barcelona this time. Good evening, Dr. Maria.
Hello, good evening. Can you hear me well?
Yes, we can hear you well, and hopefully everybody can hear you as well. So Dr. Maria will be speaking about IVF and egg donation, process, risk, and limitation. And Dr. Maria is just great fertility expert, inspired by her patients and looking for solutions tailored for the patient needs. And you probably know Dr. Maria from her previous webinar last year, so it's just great pleasure to meet you here again. And this evening we will focus on IVF and egg donation, but there will be even more because Dr. Maria will answer all your questions during the Q&A session. So don't hesitate, don't be shy, type your questions in the chat section if you have any, and you can do that during the presentation or after the presentation. And we will be dealing with the questions in about 25 minutes after Dr. Maria's presentation. So straight to the presentation. Dr. Maria, are you ready to start?
Yes, I'm ready. Thank you so much, Sophie, for the wonderful introduction. As Sophie has said, the topic that we're going to discuss today is IVF and egg donation, the process, the risks, and the limitations. So basically, egg donation, what is it? I'm sure that most of you already know it, but it's the process by which a woman donates the eggs to enable another woman to conceive as part of an assisted reproduction treatment. And for what kind of patients would we recommend to undergo egg donation? Basically, egg donation is one of the treatment options that we offer to patients who have early menopause, patients who have had previous chemo and radiotherapy and not producing any eggs anymore, patients who have low egg quality, or patients who have done previous fertility treatments that unfortunately did not give them a pregnancy. In the cases also of patients who have are carriers or are affected with genetic diseases that cannot be diagnosed on the embryos with the PGT, and also in cases in which the ovaries are not excessive for an egg collection. And how does egg donation work in Spain? So basically the legislation is a little bit different in each country. And in Spain, there are three very important characteristics when we are about to do an egg donation cycle. First of all, egg donation in Spain is anonymous, which means that the donor can know nothing about the identity of the recipients, and neither the recipient can know anything about the identity of the donor. The second important thing is that egg donation in Spain is an altruistic act. It is true that donors will receive a compensation, but it is just a small compensation for all the days that they have to come to the clinic, do tests, and all those things. And then the third very important thing is that under Spanish legislation, it is the medical team that selects the donor according to the phenotypical and immunological characteristics of the patient, which means that we have to try to look for the donor that looks as much as you as possible. So one of the most asked questions that we get when we are about to do an egg donation cycle by patients is, how do we select the egg donors? So basically, egg donors must be healthy women who must be between 18 and maximum 34 years old. Why maximum 34? Because we know that it's after 35, more or less, that there is a very important decline on egg quality and egg quantity, and therefore to diminish the risk of having any kind of problems related with the quality of the eggs. That's the reason why we have to choose and use donors who are between 18 and 34. We have to do a very exhaustive medical history of the patient, of the donor herself, and also of the family history. We have to do psychological tests, and we're going to do tests to check their blood type, to check the vitals, make sure that they don't have any infectious diseases, also STDs. And on the other side, we're also going to do some genetic tests. From the genetic part, what the test that we're going to do is the karyotype, which is our kind of our map of chromosomes, which must be normal. And if it's not normal, we cannot accept the donor into the program. And then we can also do the panel of recessive diseases, or what we call genetic carrier screening. What is the genetic carrier screening? So basically, all human beings, or most of us, we are carriers of some genetic diseases that, even though we are not affected by those diseases, if we are about to have a child with someone who's a carrier of the same disease, we would have 25% chances most of the times of having a baby who might be affected with that disease. So one of the things that we can do is do that genetic carrier screening to the donor. And then in the case that we use a sperm donor, we can do that screening to him as well. Or in the case that we're using partner sperm, we can screen the male of the partner, because that way we will be able to match the donor not only according to the physical characteristics, but also according to the genetic information that we have, to minimize the risk of having a baby with genetic diseases. It is important to know that genetic carrier screening that we do, we can screen for a lot of diseases, but most of those diseases are diseases that usually are diagnosed during childhood, and usually are diseases that could have a very important detrimental effect on the quality of life of the person who is affected. We're speaking of diseases like cystic fibrosis, muscular spinal atrophy, X-Fragile syndrome, hemoglobinopathies like thalassemia, alpha thalassemia, beta thalassemia, sickle cell anemia, and all those things. And apart from those genetic tests, we also have to do, obviously, gynecological tests to make sure that the donor has a good AMH, has normal scan, and that there are not going to be any issues to undergo the egg collection and the stimulation with the cycle. And well, the matching is what I have just explained how we do the matching. We will do it according to the physical characteristics of the person who's going to receive the eggs and the donor, looking for the maximum similarity. And then we can also do the matching according to the genetic information that we got from the test that I've just explained. And what information will you receive from the egg donor? So it is important for you to know that the information that you will get, it's basically the age of the donor, the race or ethnicity, the blood group and RH, and then you will have the general phenotypic characteristics of the donor, related with color of hair, color of eyes, color of skin, height, weight, all those general characteristics, but nothing that could compromise the anonymity or the identity. And what test will you need to do if you want to undergo an egg donation cycle? So basically, you will have to do vitals as well. The vitals is part of the basic mandatory test that we need to do under European legislation to undergo any fertility treatment. We will also check that you're immune for rubella. We will check your blood group to look for a blood group that it's or either the same or either compatible with with yours. You will have to do also full blood count or hemogram. We will check also that your thyroid function is normal, that your vitamin D levels are good. We will also screen and to see that there are no pap smear test abnormalities. We will do an ultrasound examination just to make sure that the uterus is completely normal inside, that there are no fibroids, no polyps, nothing that could interfere with the implantation. And then we will request for other tests depending on your age, depending on your specific case. We will probably ask for mammogram. We might require a clearance letter from your GP saying that there are no contraindications for you to achieve a pregnancy, and other specific tests depending on each individual case. And for in the case that you are doing the treatment with your male partner, he will have to do vitals as well, the blood group. We will check his karyotype, which is the genetic test that we also do to the donors, just to make sure that he's not a carrier of any chromosomical abnormalities, which could lead to have an incremented risk of having embryos that are not normal. And then we can also do, if you wish, the genetic carrier screening to do the genetic matching between the donor and the partner. And also, depending on each specific case, we might request some other tests. So what would be the timeline and how would we organize the cycle to make it as smooth and straightforward as possible? So generally, we would probably have an initial consultation through WhatsApp call or Skype, or what we call an online consultation, just to touch bases. And then usually what we recommend is to come over to Barcelona to the clinic to do a presential consultation here. In the presential consultation here, what we do is do all the tests that we have not done before, and also usually the partner will leave a sperm sample that we're going to freeze, okay? Why? Because that way, on the day of the collection of the donor, it will not be necessary for him to come over to the clinic, because we will already have the sperm frozen, and it's not going to be necessary to come to the clinic on that day. Apart from doing that part of leaving the sperm sample, if we decide that we want to do the genetic carrier screening, these tests are going to be done today, okay? And apart from that, around 2 or 3 weeks after, we're going to have the results of all the tests, and then we're going to have another consultation that can be online. You don't have to come to Barcelona, just to check that everything is okay and to set already the plan. After that, once we have all that information, we're going to select the egg donor, and the egg donor is going to undergo the process like an IVF, which means that she will require to undergo a stimulation that it's going to take for around 2 weeks, more or less. And after those 2 weeks, she will have the egg collection. On the day of the egg collection of the donor, we're going to thaw part of the sperm that we have frozen, and we're going to put the eggs and the sperm together, and we're going to fertilize those eggs, and then we're going to leave the embryos grow in the lab until they reach the stage of blastocyst, which is reached usually between day 5 and 6 of development, and then we're going to freeze all those embryos that are good quality. Okay, and once we have the certainty that we have embryos that are good quality, then what will happen is that the woman who's going to have the embryo transfer will start the endometrial preparation. Usually the endometrial preparation is started around 1 week before the period, with bloods and scans just to monitorize that you have ovulated properly, and you will have an injection of a GnRH agonist, decapeptyl, just to make sure that then ovulation does not interfere with the preparation. And once you get the period, you would start treatment with patches or pills to prepare the lining of the uterus. And around 10-12 days after, you will have to do a scan and blood just to see what is the response of the lining. And once we see if the lining is good quality and it's thick enough, what will happen is that we're going to let you know when you have to start the progesterone, and usually 5 days after you start the progesterone, it is in the moment in which you have to come to the clinic to do the embryo transfer. And around between 10 and 14 days after we do the embryo transfer, you can do the pregnancy test and find out if you're pregnant. So to sum up, that means that you would have to come to Barcelona twice. Once to leave the sperm sample and to do all the tests, and then the second time only for the embryo transfer. Okay, each time that you come, you will have to stay in Barcelona for just 1 day. When you come for the consultation, it's just that day, and for the embryo transfer as well. But for the embryo transfer, what I usually recommend is that you come over the day before, because even though that's not going to affect your chances of pregnancy, it is better that we avoid that you're stressed out on the day that you're going to have the transfer, which is from the emotional perspective, is a day which is challenging and very important. And the less stress, the better. That means that generally speaking, between the moment that you come over to Barcelona to do the initial consultation until the moment that we can do the embryo transfer, more or less, usually it takes around 3 months. Okay. We would also have the possibility, and we do it also as well sometimes, to synchronize your cycle with the cycle of the donor. But even though it is extremely unlikely that this happens, sometimes a cycle of an egg donor might not be as well as expected, and maybe we don't have the good embryos for transfer. So usually taking in consideration that most of our patients come from abroad and that they have to travel, organize themselves from the perspective of work, accommodation, it's a process which is not easy and involves a lot of preparation. We prefer to do it that way because once we have the embryos frozen at the stage of blastocyst, the likelihood that they survive to the thawing process is extremely high. It's around 98-99%. So the risk is very small that we don't have embryos for transfer. And even though it is true that there is a small difference in chances of success when we use fresh or frozen eggs, which in our case, in our clinic, we always try to use fresh eggs. When we use fresh or frozen embryos at the stage of blastocyst, the chances of success are pretty much the same. So we are not compromising that, but we are giving you more reassurance that once you come here, you're going to have an embryo transfer. We have different egg donation programs which are can offer different guarantees, and those programs are according to your needs. In the standard program, what we can guarantee you is that you will receive a minimum of 8 mature eggs from the donor, and that there are going to be a minimum of 2 blastocysts for transfer. The average number of blastocysts that we have for each egg donation cycle with the standard program, it's around 3 or 4, and the chances of pregnancy every time that we transfer one embryo at the stage of blastocyst from an egg donation, it's between 55%, maximum 60 more or less, and the cumulative pregnancy rate is between 80-85%. Then we also have the program of the exclusive egg donor, in which we can guarantee you that all the eggs from that stimulation cycle of that donor are going to be for you. But this is a program that we usually recommend for patients who already have poor prognosis because, for example, they are going to need to do a pre-implantational genetic testing because one of them is a carrier of a genetic disease that it's very likely that the embryos are going to be affected, or the male factor is very severe, or other causes like this one. And then we also have the baby warranty program, which also is a program in which there are 3 cycles of egg donation included, and we can guarantee a baby. As I've just said, the pregnancy rate per transfer more or less is around 55-60%, and the cumulative pregnancy rate out of the cycles that we do, it's between 80-85%. And the other thing that is important is that in most of the cases, we always individualize the treatments, but most of the cases we are very strong defenders of the single embryo transfer, because obviously as much as we want to help you get pregnant, for us is as important or even more to look at the broad picture, and we want healthy families and healthy babies. And we all know that to have a twin pregnancy is much more risky than to have a singleton pregnancy, because there is much more risk of preterm delivery, preeclampsia, gestational diabetes, and other complications. So generally, what we would recommend is to transfer one embryo at a time to minimize the risk of having complications with the pregnancy. The limitations and risks of egg donation are basically that one of the main limitations is that obviously egg donation is a very good tool, and it's a treatment that can help us overcome one of the main infertility problems that we are facing nowadays, which is age and the decline of egg quality and quantity with age. But obviously there are other infertility factors that cannot be addressed or cannot be I don't know how to explain it, but they cannot be solved by using an egg donor, which are, for example, some coexisting female infertility factors like fibroids in the uterus or uterine malformations, or if there is recurrent pregnancy loss because there is a thrombophilia or an immune problem. Obviously, if we're solving the problem of the quality of the eggs and the quantity of the eggs, that's going to increase the chances of pregnancy. But that doesn't necessarily mean that we don't have other issues that we have to address. Obviously, the male infertility factor is something that cannot be overcome with an egg donor, because if we have a problem with the sperm, depending on how severe is the male factor, we might have poorer prognosis, and in some cases we might even need to use a sperm donor, because otherwise we might not be in a situation of being able to give the patient a pregnancy. The other important thing is that and for me it's very important to understand that, is that using an egg donor is not a guarantee that all the embryos that we will have out of an egg donation cycle are going to be euploid embryos, which means that are embryos that are chromosomically normal. It is true that when we're using the eggs of someone young, the number of embryos that are going to be chromosomically abnormal is going to be much less than if we're using the eggs of someone older. That's going to lead us to have embryos which are abnormal. But that's not a guarantee 100%. And there are some patients that sometimes expect that all the embryos are going to be chromosomically normal when we use an egg donor, and that's not exactly like this. And the only way to have the certainty that the embryos that we have are chromosomically normal is when we're doing pre-implantational genetic testing. That, by the way, is not a technique that is medically indicated in all the cases, and even less when we're using an egg donor. And sometimes, as I was saying before, even though it is extremely unlikely, we might have unexpected results with an egg donation cycle. And obviously, biology, it's not mathematics, and sometimes the cycles might not go as we expect, even though it is extremely unlikely. In our case, as we give the guarantee of the minimum 2 blastocysts with a cycle, if the cycle would not go well, we would do another cycle until we with a new egg donor, until we get the minimum of the 2 blastocysts guaranteed. And that's pretty much everything I wanted to explain. I hope that the information was useful and that it was clear enough. And I will be happy to address any questions that the attendees might have.
Yes, and thank you for the presentation, which was indeed informative, and I hope that this is also helpful. And we indeed have questions coming up, so we will then take a look on the first one. Just please give me a second. And the first question is, I have quite a stressful job and about to embark on my second egg donation program. And we have actually, something was cut. But we have the follow-up question, okay. Is there any advice you can offer?
Obviously, stress can play a role on the likelihood of success. And my recommendation would be, I know that obviously it is not easy to address stress, but if there is anything that you can do to be a little bit less stressed with your work, that's going to probably it's going to be probably helpful. What I would suggest is that you try to find some time for yourself every day. Tools like meditation, doing yoga, a lot of times are useful. Doing some sport as well, not only for general health, but also to manage stress. It can be very helpful. And I have some patients who have had very good experience using also acupuncture meanwhile they were doing the treatment. But if the main source of stress is your job, Obviously, that is very personal and that depends on each specific case. But if there is any way that maybe you can, I don't know, work a little bit less hours or try to look for some help there, and that's probably going to have a positive effect not only on your cycle but on your overall life.
Yes, and thank you. And we have actually one more comment. If this can change anything, I'm aged 49, but I think that in a case of stress, it's almost the same. When
Yeah. In the case of once we're about to do egg donation, we are removing somehow a little bit the part of the stress that we have with our biological clock and with age. It is true, and it is very important to remind that in Spain we treat patients up to the age of 50. We don't treat patients who are over 50. So it is important that if you're looking to do an egg donation, that you start to contact the clinic already and to start doing all the exams and all the process. The sooner the better, just to make sure that everything is in its proper place and that you can start relatively quickly. And regarding the stress, I don't think that the age should be here a major role.
Yes, and thank you for all the answers and all the questions. And we will now take a look at the next question. Any information about price policy?
If you want information regarding price policy, I would kindly ask you to contact us through email, and we can, all the team that is responsible for that are going to give you all the information.
Yes, and I will only add that everything from today's and all your questions will be forwarded to FETI International tomorrow morning, so they will not forget about you and definitely will come back with some information. So we will now, I think, ready to take a look at the next question, which we, of course, have already waiting for you. What is the age limit for egg receivers at your clinic?
Yes, the age limit for egg receivers at our clinic is 50 years old.
Okay, understood. And then we can take a look at the next question. And here it goes. If the egg donor and the partner both did the karyotype tests and both came back normal, is there a risk for chromosomal abnormalities at birth or during pregnancy?
That's a very good question indeed. Yes, even though the egg donor has a normal karyotype and the partner has also a normal karyotype, that doesn't necessarily mean that the baby is going to have a normal karyotype, because the karyotype of the baby will depend on the chromosomes of the egg and the sperm, which are not necessarily exactly the same as the normal karyotype of each one of them, because that also involves some processes of the division of the cells that sometimes with age or sometimes because they fail, they might not divide properly, and then the number of chromosomes might not be okay. So answering to your question, yes, there's still a risk. Obviously, the risk of chromosomical abnormalities, if we're using the eggs of an egg donor, that usually she's young, and those security mechanisms that the cells have when divide, they are working properly, and the male karyotype is normal, this risk is low, but still it's there. So if you are concerned about that, my recommendation would be or either to do pre-implantational genetic testing. That way you can have the certainty that the embryo that you're transferring has normal number of chromosomes, or if that is not medically indicated, then obviously this is not a technique that it's for everyone, and even less if there are no medical indications. The other thing that can be done is to an early screening for genetic abnormalities that you can do through a blood test in the first trimester of pregnancy, and then apart from that, do all the tests related with the regular screening that you do between 8 and 11 weeks of pregnancy.
Yes, and thank you for your explanation, Dr. Maria, and of course for the question. And there is more. So we will now jump to the next one. I did 3 IVF cycles here in Florida. Every time I had one egg that was big enough to transfer, and each time it burst before he could extract it. He said that IVF meds hurt me. I had more eggs on my sonogram before I started IVF. I am 43. I would like to get pregnant this year. Do you advise donor eggs?
I mean, look, even if you're still producing eggs at the age of 43, which there's a lot of patients who are still producing some eggs at the age of 43, most likely the quality of most of those eggs is not going to be good. So I cannot say that it is impossible for you to achieve a pregnancy with your own eggs at 43, but what I can say is that the realistic likelihood is very low. So if we speak about the percentage of having a live birth with your own eggs at 43, it would be around 5% maximum. Okay, so if you ask me for the treatment option that would give you without a doubt best possibilities of achieving a pregnancy and having a healthy baby, it would definitely be to use the eggs of an egg donor, and even more take in consideration that you have already tried IVF with your own eggs several times. Somehow I think that once you've tried with your own eggs, sometimes before considering egg donation, it is a little bit easier because at least you can have like the peace of mind to tell yourself that you have already tried and unfortunately it did not work, and you can somehow close a chapter and say, okay, now I feel like I'm ready for the next step. Good luck whatever you decide to do, but I would probably recommend egg donation.
Yes, thank you for the answer. And of course, good luck and fingers crossed for you. And we will now also take a closer look at the next concern, which we have asked in a question. Hi, have you successfully treated females with adenomyosis in the past? Is there anything you would recommend to do prior to commencing an egg donation cycle?
Adenomyosis can be very tricky sometimes, and it's true that there is some data saying that patients who have adenomyosis might have a little bit less likelihood that the embryos implant. It's a disease that even us who are fertility experts still are trying to understand. But yes, we have some patients that we've treated with adenomyosis and they have achieved pregnancies. It is important to see if there is any other infertility factor that might contribute to all your situation. And what I would recommend in that sense, I don't know if there is any endometriosis in your case added to the adenomyosis, but depending on the symptoms and depending on the situation, maybe to try to decrease all the inflammatory environment that it's a lot of times linked with adenomyosis and endometriosis, sometimes to take the pill for some time or to take GnRH agonist might help to have a better environment for afterwards for the implantation. But obviously I have very little information, so I'm just generalizing a little bit.
Yes, and thank you for explaining this to us, Dr. Maria. And we will just come back for a second to the previous question as we have a follow-up comment. Thank you. If you want to contact me, I would like to set up appointments with you for September if possible. And we will.
Perfect, Alisa. We're gonna make sure that someone from our team contacts you as soon as possible, and that they organize for us to set the appointment. No worries.
Definitely. So we will now take indeed the next question, the practical, very practical one. Do you treat patients with HIV?
Yes, we treat patients with HIV, but we need patients with HIV to be under the care of an infectologist, and that the patients are in a stable situation, that the viral charge is negative, and that they are having a good follow-up. And also we require it's mandatory for us to have a clearance letter from the infectologist who's treating the patient saying that this patient is stable, she's fine, the viral charge is negative, the CD4s are fine, and that we can go ahead with the treatment. But if that's the case, no problem, we can treat.
Yes, thank you for the question, of course, and for your answer, Dr. Maria. And we will then take the next question. Hi, sorry if you already covered this as I went a bit late. I'm preparing for a second egg donation cycle as the first one was unsuccessful.
Mm-hmm.
Transfer of 2 embryos, this time maximize chance of success.
Mm-hmm. That's a tricky one. Look, mainly chances of success when we're transferring the embryos depend more on the quality of the embryos that we're transferring rather than the quantity. It is true that if we look at the figures when we're transferring 2 embryos, there's a slightly higher likelihood of achieving a pregnancy, but there is also the risk of having a twin pregnancy. As I was saying before, our policy is to try to minimize the risk of having twins in general. And our recommendation generally is to transfer 1 embryo at a time. And if you did not achieve a pregnancy with one embryo transfer, we can always do another embryo transfer. That obviously has to be individualized and really depends mainly on the quality of the remaining embryos that you have. So if you have embryos that are frozen, it's important that you discuss with your doctor the quality of those embryos and that he or she makes the assessment with you. And if not, if it's a brand new cycle, that will depend also on the quality of the embryos and if you have also any other risk factors for having more complications with the pregnancy. Let's say, for example, if you have had uterine surgeries or you have had conization because you had a problem with the pap smear or other things that might be contraindications for having twins. So I'm trying to say again that my recommendation usually is to do a single embryo transfer and avoid transferring 2 embryos, except if the embryos are poor quality and maybe otherwise the chances of pregnancy are not very good.
Yes, and thank you. And actually, we have very related question speaking about twins as well. How high is the risk of twins in case of egg donation? So maybe any additional comment on that?
Yeah, so basically, if we transfer 1 embryo at the stage of blastocyst, because we always bring the embryos up to the stage of blastocyst, the chances of twins when we're transferring just 1 embryo are less than 1%. There's always the risk that the embryo can split, but the risk is less than 1%. If we transfer 2 embryos at the stage of blastocyst at the same time, the risk would be around 25%.
Yes, and great. Huge thank you for a very sharp answer on question. Indeed. We have now the question about BMI, and it's actually, I think, third time, 3 questions we have, third time. So I will take those questions in a row. And if you can comment on that, all 3 questions, because they are really, really similar. So do you have a BMI limit for egg donation treatments? And then what is BMI acceptable for IVF treatment? And then is there a maximum and minimum BMI or weight I should be at before transfer?
Okay, so basically we have a cutoff or a limit of a BMI of 40. We don't treat patients who have a BMI more than 40. And with BMIs between 35 and 40, we assess the general situation of the patient. It's not the same someone who is super healthy, but the only problem that has is that the BMI is high, than someone who also has a heart disease, high blood pressure, diabetes, and something else. Anyway, apart from having said that, the ideal thing would be to have a normal BMI when we are about to have the transfer and when we are about to do the fertility treatment and afterwards for the pregnancy. Not only because the chances of a successful outcome are much higher, but also because there is less risk of miscarriage and afterwards much less risk of complications along the pregnancy, both for the baby and for the mother. So we are very conscious that a lot of times it can be super difficult and super tricky to lose weight. It's one of those health problems that that's one of the reasons why it affects a lot of people in the world. That it's something that it's not easy to address. But most of the times, through a good program of diet and exercise, the good mentoring and coaching, a lot of things can be addressed and a lot of things can be done. And even though maybe you don't reach a completely normal BMI, you can lose a good amount of weight. There is something else to consider, because it is obviously not the same someone who is 30 years old and needs to do a fertility treatment, and you have the time to say, look, maybe you should lose all this weight before we can do the treatment, than for someone who is 48. So there's like a lot of factors that have to be taken in consideration. Obviously, that someone who has a higher age has also high weight, that complicates more things, not only because from one side we don't have that much time, but from the other side, already age is a risk factor with the pregnancy. So there is already a higher risk of having complications. And as I was saying before, for us, it's super, super important to help to build healthy families and healthy babies. So that's the line in which we're working. So to sum up, because I'm speaking a lot, our limit of BMI would be 40. Between 35 and 40, we would individualize each case and see if there are any other risk factors for having complications. And less than 35, between 35 and 30, we would also try to help manage the weight and help you be in the best shape possible for the transfer and to have a healthy pregnancy and a successful outcome.
And thank you for clarifying this, and thank you for speaking so much. We appreciate that a lot. And actually, we have also the next question for you. So let's take a look. How long does it take after failed assistance echo process to start with egg donation?
I'm sorry, but I don't really understand exactly what are the answer that you're looking for. When you say after failed assistance echo process, you mean when you have had a negative outcome, when you have had one cycle, one embryo transfer, and you did not get a pregnancy?
Someone is typing, so hopefully we will have a follow-up comment in just a second. Yes, it is here. Okay, so 1 second. We had 2 failed echo treatments stopped this month. How long does it take to start with egg donation?
Well, with egg donation, you don't need, you are not going to have an ovarian stimulation. So if your tests, if you had your period and your tests are fine and you have everything ready, you could start as soon as you have all the tests done. There is no need for waiting, unless there's something specific in your medical history that we have to study before. If all the tests are ready, you could start with the next period without having to wait.
Yes, and thank you. And now we will take a look at questions which are connected to the information about donors. And we have quite related 2 questions. So I will publish those questions together. And the first one is, we want a donor with the university education student. Could it be guaranteed? And the next question is very similar. What information you provide on the donor? Is it possible to know the nationality of the donor, completed education, and so on?
So look, even though most of our donors are like young professionals and students from college who are here on Erasmus or who are from here, we unfortunately cannot guarantee 100% that the donor is going to have university education, and sometimes we don't have the information about the completed education. So I would have to say that there is no guarantee 100%, and usually we cannot provide the nationality as well. We usually give the information regarding the ethnicity or the race, but not the nationality.
Thank you a lot. And then we have still a question about donors. So let's take a look. What happens if there is no suitable match? Do you go to a match with maybe less suitable characteristics, or do you wait until there is a donor that become available that is more suitable? Thank you for an informative and interesting presentation.
Thank you, Lisa. Look, if, for example, I think your question is super interesting. If we have no suitable match, which usually doesn't happen, it's usually a matter of time, or it's very difficult to match up a specific patient with a donor because of whatever characteristics, because from the genetic side or the phenotypic or the phenotype, we always discuss the situation with the patient and we explain them. We usually wait, but for example, there are patients that after maybe waiting some time, they say, no, look, we prefer, I explain them a little bit the option of the donor that we have, that it's more suitable to them. And then they say, okay, we're happy to go ahead with that donor, or no, look, we prefer to wait and that you find someone who is a little bit more similar to us. So that's how we try to do it. But most of the times we practically have very few cases in which we have this situation. Most of the times we always find a good match.
Yes, thank you. And there is also additional question about donors coming back to the previous one, but can donors be not Spain residents?
No, they are residents. The fact that they are always here, at least for a long time, if they are students.
Yes, and the last one I think about donors. What do you think on open donor when child can know donor's ID once he turns 18?
That's a very hot topic. Look, it's a tricky situation. It is a tricky situation, I think, because obviously. Nowadays, genetic information is getting all over the place everywhere on the internet, and you can go and do your genetic tests and know a lot about your ancestries and things like that. So, in that sense, I think that as we don't know how this is going to evolve, one of the things that I am more supportive to do, and that's one of the things that I recommend to all my patients who are about to do egg donation, is that to not keep it as a secret, but to disclose that to their children, even though the donor is anonymous, just because otherwise, as we don't know how this is going to evolve in the future, we don't want that your children find out without you having told them that. So it's going to be a tricky situation. We don't know exactly what's going to happen in the future about that. But I think that they deserve to know at least that they come from an egg donor if they wish to.
Yes, great. Thank you. And we have the next question on the list. Is there any follow-up treatment that you do after pregnant in case there is miscarriage history?
Well, in patients who have recurrent pregnancy loss or have had several miscarriages, we always do a study first before getting them pregnant. And then most of the times, if it's indicated, we give them some treatment also to help with that. And then we follow up together with their gynecologist or obstetrician to see how things are evolving, and then decide together if they need to keep on taking some medications or not. But that's usually done with the obstetrician.
Yes, thank you. And straight to the next one. Are the donors used only once in your clinic?
No, the egg donors, there is a limitation of using the donors in Spain, which is that donors cannot have more than 6 children alive in total between the children that they got from themselves and the children that they gave to other people through egg donation. So no, we have donors that we have used more than once, but always taking into consideration this limitation. And also the Spanish Fertility Society, apart from the limit on the number of children, also recommends to not do more than six egg donation cycles.
Yes, and thank you. And we still have a lot of questions to go, and time is flying, so we will take a few. Okay, Dr. Maria, is it okay for you?
Perfect, yeah.
Okay, this will be this question. What do you look for in sperm quality?
That's a very good question. That really depends on each patient, and it really depends on the medical history. But obviously, we do semen analysis always, and then in some cases we might also indicate to do fish test. On the sperm, which is a test to check the percentage of genetically abnormal sperm to see if there is a higher risk of having babies with chromosomical abnormalities. And then we also check for the DNA fragmentation of the sperm, especially in cases of recurrent miscarriages or depending also on the quality of the sperm. We also have an andrologist working here in the clinic, so all the complicated cases from the male side, we always assess them with the andrologist, and if necessary, we can run a lot of other tests, but that really depends in the context. But more in general terms, we would do the semen analysis, and a lot of times the fish in the DNA frag.
Thank you for your explanation, and we will then take a look at the next question. I have done 2 ICSI treatments. We have a very low fertilization rate. First ICSI treatment, 5 mature eggs, but 0 fertilization. Second treatment, 5 mature eggs, only 1 fertilized egg. Failed implantation. I'm afraid if we do ICSI again, we will get the same result. Now we are seeking answers for causes and treatments to improve the fertilization rate and the chance of pregnancy. Can you comment?
Yeah, so thank you for the information. I don't know your age, which here it's something very important, and I don't know what the biologist said about the quality of the eggs. Obviously, to have 0 eggs fertilized the first time out of 5 mature eggs and just 1 egg fertilized out of 5 mature eggs the second time, it's also telling us that probably there might also be a problem with the sperm. I assume as well that if they indicated ICSI, that means that probably there was also a problem in the sperm to indicate the ICSI. So we would have to look and see if maybe there is what are the tests that have been done and if there are any other tests that should be done in that sense, and look at the sperm quality and the egg quality to see how can that be improved. Sometimes, depending on the quality of the sperm, we might also look at the DNA fragmentation, and sometimes that can help to select the sperm that it's less fragmented. We could also use a device called Fertile that might help us to select this kind of sperm and help us have a better fertilization rate, but that
So
really depends.
the
Yeah,
follow-up.
my age, yes, 37, my husband 32, sperm motility is 5%. Hence our first treatment was ICSI. Only standard blood tests were done on both of us, no genetic tests, no other tests. Okay, so the sperm motility is pretty low. I don't know if there was any other thing altered in the sperm parameters, and I also have limited data about other things of the case. But obviously, with your ages and with 2 cycles, which is already 2, I think that there is place for studying a little bit more your case, assessing if there are any other tests to be done before you consider egg donation or any other solution for your treatment.
Huge thank you for the question, follow-up question, and your answers to all of those questions, Dr. Maria. And we will then jump to the next one. I am 48 years old and on menopause. My partner is 39. I need to have an egg donation. Is any concerns that I should consider on choosing a clinic with egg donation?
That's a very good question. What I would recommend is that you look for a clinic in which whoever is your consultant, you feel trust and confidence with that person, and that It's a clinic that has good reviews and good reputation, that they fulfill a little bit the requirements that I explained during the presentation today about how the egg donors are selected. Check as well which are the warranties that they can give you in the sense of number of embryos to transfer, that they transfer at the stage of blastocyst. Those are the most important things, I'd say. And then mostly the feeling that you get with the clinic. Probably a lot of times what I recommend to patients is to have several consultations with several different clinics, and then once they are completely convinced and they found a doctor or a place where they feel trust and confidence, to do the treatment there.
Yes, thank you for your answer to this question. And the next one will be this one. In case in future a situation demanded a genetic test between child and mother, what will the result show in case of egg donor?
Okay, I'm understanding that as a test to see if the mother is the biological mother of the child. So obviously that would be seen in a test like this. I don't know if you're referring to any specific test, but obviously that test would show that the mother is not the biological mother in that sense. But not that part of the genetic information is not hers.
Yes, thank you. And then this one, what percentage would you give to someone who is 44 achieving a live birth?
If we're speaking about achieving a live birth with egg donor, I think that the live birth would be very good, because if there are no other medical issues, we would be speaking about around 40% more or less, because we have to take in consideration that unfortunately around 10-15% of the pregnancies that we get after doing a fertility treatment, even if we do it with the eggs of an egg donor, end up being miscarriages. But the live birth would be very good. If we're speaking about live birth with your own eggs at 44, it would be less than 5% as well, 3-4% or something like that.
Yes, and huge thank you for the question, of course, and for the answer to this question indeed. I'm checking the questions because we had a lot of questions today. I think that we are almost done, although we have 2 to go, I think. What does grade 1 quality embryo mean?
And when you say grade 1 quality embryo, I am not certain if you're speaking about embryos on day 3 or on day 5, because usually when we have embryos on day 5, we usually grade them with a number and 2 letters, but usually grade 1 would be like top quality.
Okay, thank you. And we will then take, I believe, so the question which we still have to be asked, and I just lost it. Can you believe that? Yes, okay. Do you recommend clinics with executive program that we pay double the cost and they guarantee 3 cycles and the money back if the pregnant is not achieved?
I mean, our baby warranty program is also a program like this one. We offer that as well. I think that it really depends on your individual situation. I think that, for example, this is a very good program for couples who have already done several cycles. They have already had a very long infertility journey. They have already spent a lot of time, effort, energy, money on doing cycles, and that probably for them it is very important to know that if they don't achieve the pregnancy, at least the money is going to be refunded, because obviously to have infertility, it's already a very difficult situation, but let's not forget about the economical burden about doing fertility treatments. And it's true that in that sense, when you're doing one of those programs, you're paying more money, but a lot of times, for a lot of patients to have the peace of mind that if they don't get a pregnancy, the money will be refunded, helps them to decide for one of those programs. Having said that, we also have very, very good results with the standard programs that we use. So I don't think that this program is something for everyone.
Yes, and we have like very important question, but we also said about it already. What is the clinic Dr. Maria is working?
I'm at 30 International in Barcelona, Spain.
Yes. And okay, can we have a final question, Dr. Maria? We have
Yes.
actually, yes. Will the genetic test show that the mother is the one who gave birth to the child?
There is no genetic test to say which is the mother who gave birth to the child, but in that sense, for all the part related with the custody of the child and all those things, you should not be concerned, because obviously all the paperwork that it's signed before doing any treatment, it is very clear, the contract that the donor has with the clinic, and it is very clear on all the paperwork that you sign that you are the mother and the personal legal mother and person responsible for that child, and that the custody is yours. So
yes, and thank you. And as I said, I believe that we did all the questions we have. If any was overlooked or was left without any answer, as I assure you, we will be back with feedback and answers directly. I put also the name of the clinic in the chat section as well. And yes, for tonight, there will be only shout outs. Thank you. Thank you for
you're
the name,
welcome,
no
Anna.
problem. And thank you for your answer. That makes a lot of sense. And indeed, thank you for the presentation and for all the questions and your answers, Dr. Maria, which you shared with us. We have more shout outs, of course. Thanks from everybody who was joining us today. It was very informative indeed. And
Thank you for all of you for attend.
yes, thank you especially for your time. And of course, the recording from today will be available on our website tomorrow, so you can definitely watch it again or share it with anybody who may need information. So feel free also to subscribe to our YouTube channel, Facebook or Instagram to be always up to date. And you can as well follow 30 International. They have as well great content or their social media. So I can only encourage you to do that. And Dr. Maria, do you want to add anything or make any final comment? Please, you can do that now.
No, I just hope that everyone found the presentation informative and useful. That if you have any doubts, questions, or you'd like us to assess your case, we will be more than happy to have a consultation with you and discuss your case. And whatever you decide and whatever you go to your fertility treatments, I wish you all the best of luck. Okay.
Yes, and I answer also your comment and brilliant presentation. It was indeed. And thank you one more time from attendees straight to you. And actually, there's one more thank you this time. And this thank you is from me for your time, for your presence, and for your support. And I was here with you for 45 weeks, greeting you with the sentence, I'm Sophie and I'm your host today. And my aim was to develop IVF webinars project. And I also tried to make this place nice for you to be here and to be filled with reliable knowledge, but of course with smile as well. And it was just huge experience, which I will take along with my journey further. So I keep fingers crossed for all of you and for all your challenges and for the things you are dreaming of. And I can assure you that you are staying in the good hands of the whole Egg Donation Friends team. And so, yes, for today, it will be all. Thank you, Dr. Maria. It was a huge pleasure and great and brilliant evening.
Thank you so much, Sophie. It's been a pleasure to do the webinar with you and to work with you.
Yes, and thank you. And this will be the wrap. And good night.
Good night. Bye.